and I'm going to talk about the coronary artery disease. This is the content I'm going to be presenting. So, the human heart is an organ that pumps blood throughout the circulatory system, supplying oxygen and nutrition to the tissue and removing carbon dioxide and other waste. The heart circulates through two pathways, the pulmonary circuit and the systemic circuit. Now, of course, our heart is also a muscle, so it needs some fresh supply of oxygen and nutrition. Therefore, the first branches of the aorta are the arteries to the heart's muscle. The oxygenated blood from the aorta is carried through two main arteries, the right coronary artery and the left coronary artery. These coronary arteries wrap around the surface of the heart to supply blood flow. They ensure adequate oxygenation of the myocardium. So, coronary artery disease, also known as heart disease, it is a condition in which fatty deposit called plaque builds up in the heart's arteries. These deposits cause arteries to become narrow and blocked, which restricts blood and oxygen flow into the heart's muscle. In atherosclerosis, fatty deposit of cholesterol and other cellular waste product builds up in the inner lining of the heart's arteries. This causes blockage of arteries and prevents oxygen-rich blood from reaching the heart. There are many steps in the process leading to atherosclerosis. The atherosclerosis process begins with cholesterol and spear-shaped bodies called lipoproteins that transport transports the cholesterol. So cholesterol is a substance found in all animal-based food. So it is critical for many functions, but under certain conditions, cholesterol can be harmful. The lipoproteins that transport cholesterol are referred to by their size. The most commonly known are low-density lipoproteins and high-density lipoproteins. LDL often referred to as bad cholesterol, and HDL often referred to as good cholesterol. Oxidation, it is an damaging process involved in the triggering of the atherosclerosis. It is a chemical process caused by the release of unstable particles known as oxygen-free radicals. It is one of the normal processes in the body, but under certain conditions, such as exposure to cigarette smoke and other environmental stresses, these free radicals are overproduced, and they can be very dangerous, causing damaging inflammation and even affecting genetic materials in the cell. In heart diseases, these free radicals are released in artery lining and oxidizes LDL. The oxidized LDL is the basis for cholesterol buildup on the artery wall, and damaging leads to the heart disease. So the blockage in the artery eventually, as the buildup continues, the arteries become narrow and hardens, causing slow blood flow, preventing sufficient oxygen-rich blood from reaching the heart's muscle. These narrow and inelastic arteries not only slows down the blood flow, but also becomes vulnerable to injury and blood clot formation, which is usually what triggers a heart attack. A heart attack can occur as a result of one or two effects of atherosclerosis. The plaque itself develops tear, blood platelets sticks to the site to seal off the plaque, and the blood clot forms. A heart attack can then occur if the blood clot completely blocks the passage of oxygen-rich blood to the heart. The less common one is when the artery becomes completely blocked by the plaque itself, and it becomes so extensive that some oxygen-deprived muscle cells in the heart dies. So currently, the best available drug to treat high cholesterol level is statin. It has been available for more than 25 years and has been enormously successful at reducing the burden of heart disease. It has shown to reduce the risk of heart attack, and stroke by up to 35%. Unfortunately, for some patients, they cannot tolerate statin and can't take large dosage to adequately reduce cholesterol level. Therefore, a new drug therapy known as proprotein convertase, subtilisin caxin type 9, PSCK9 inhibitor, has been shown to reduce bad cholesterol level by as much as 50 to 70%. Although these drugs are given by injection every 2 or once in a month, they are injected through very small needle and they produce very little or no pain. This new class class of drug has appeared to be very well tolerated even in patients who cannot take sustain due to the adverse effects. Another treatment is where wireless sensors for severe heart failure. So a new device that helps doctor keeps tab on people with severe heart failure by measuring pressure in the pulmonary artery, which is which transports blood from the heart to the lungs. The cardio ME and HF system is implanted into the pulmonary artery. From there, it wirelessly sends data to the doctor, who can then adjust the person's treatment as needed. The goal is to prevent hospitalization for flare-ups of heart failure symptoms. So coronary artery disease is one of the single leading death in Australia, and therefore awareness should be raised about the prevention of